And welcome, Gregory, to my drawing room.
Thank you so much for having me. Begum Saab, you look fabulous tonight.
Thank you, Gregory. You're so kind. Tell me now, are you a good doctor or a bad doctor?
Well, I think I'm a good doctor and an excellent teacher.
Well, I don't know about the good and the bad, darling, but you're a very naughty doctor.
Why is
You
that?
know, wearing that red tie. And you know, Johnny, red is my weakness, especially a red tie. Looks fabulous.
Thank you.
Really. Acha, you also the chairman of the Community Health Services at the Agha Khan University Hospital.
I'm the chairman of the Department of Community Health Sciences at the Aga Khan University. That's
I mean,
right.
what does that mean, the Community Health Sciences?
Well, I tell my students that most doctors see individual patients. Community health science, we focus on the community. We take care of communities. And that community can be as small as a neighborhood or the whole nation.
I understand. So that means that you have good contacts in the community, really, and you respect it there. Sweetie, I'm thinking, you know, Pinky has been on my case. She wants me to contest the next general elections. So that means that you can help me with mobilizing the community in my favor also, huh?
And you can help the community by promoting their health.
Oh, darling, I'll do a lot for the community, don't worry, especially the men, really. You know how it is in this country. Acha, tell me, since when are you based in Pakistan?
I have been in Karachi at the Aga Khan University for a year now. Although no stranger to Pakistan, I've been coming for 20 years now.
Really?
Yes.
Hi, how wonderful. And how come I didn't meet you before, Gregory? Where were you hiding?
You never invited me
And who were you
before.
with all this time?
Well, I'm good friends with our dear friend, our mutual friend, Sheikh Amr Hassan.
You've lived, I mean, apart from Pakistan, you have actually lived and worked in many, many countries.
Yes, I've been working in public health and community health for many years and worked in many parts of Africa, Central Asia.
Taking Pakistan, or maybe including Pakistan in the list also, where have you enjoyed, or which country or which community has been the most challenging, really, for you?
Most challenging? It has to be Pakistan, also, although it was always my first love. I've spent many wonderful years here and have enjoyed the challenge. Pakistan, while the people are very loving, the problems are very challenging.
How do you like to spend your time in the evenings, really?
Well, I love to cook. Our friend Sheikh Amr and
I know.
share recipes, and I love to have little dinner parties, and it's fun.
You have been very actively sort of working on issues like HIV also. Gregory, I want to know from a doctor, from somebody who's in the field out there, where do we stand in terms of HIV or AIDS risk, really?
Yeah, it's an important issue you're raising. I tell my students the attitude in Pakistan has been Hanuz Dili Dur Ust. HIV is far away, and actually it's not. We've come to a point where it's a serious problem. Now, at this point, in most major cities in Pakistan, in Saqqat, in Hyderabad, and Karachi, 20 to 25% of drug addicts are HIV positive. It's a serious problem that we have now. It's very much like the epidemic in the subcontinent is more like Central Asia. It's not like America, where it was a homosexual disease at the beginning and developed into a more serious problem. It starts here in drug addicted populations. Sharing needles, dirty needles, spreads HIV, and that goes into the blood supply. The problem is then their wives get it, their children give it. They sell blood, and people who buy the blood, the hospitals that buy the blood, if they don't test it, then spread it to their patients. So it becomes a very serious problem. And we're right at the beginning of a very serious problem. Now is the time to act very strongly to help these people, to identify who's HIV positive and try to keep them from spreading the disease. So it's a real critical time.
I know, Johnny, it's also depressing. But tell me, do you think the government is taking this issue seriously? Do you see any initiative coming from the government?
Oh,
really?
yes. Oh, yes. We're fortunate to have lots of good international support on this issue. And the government, our president and prime minister have all spoken about HIV in public speaking. Public speeches. That's a big step for a country like Pakistan, to have people in the highest level speaking about this disease and not being afraid to talk about it.
I know. But tell me, what would be a good way to create that awareness, really? I mean, the health awareness amongst people here, because people seem to be quite, unaware about things that are going around, really. So how do we raise that awareness?
Well, you're right now raising this awareness, and people like you, people in the media, public leaders of all levels need to be addressing this issue. I'm very happy to say that in the communities that we work in a number of Kachiyabadi here in Karachi, And the local leaders are very articulate. These are simple people, uneducated people many times, but they're very articulate and they understand the needs of the community. They're not shy to talk about this problem. And I take a lot of inspiration from these simple people.
Acha,
Thank
now
you.
coming to diseases in Pakistan, really. What kind of diseases do you see on the rise in this part of the world?
This is an important question and issue. When people talk about Pakistan, they usually think about the old problems. The old problems are still there. Problems of malnutrition are still there in the country. Problems of infectious disease are still there in the country. We have a major problem with quality of water, sanitation. But the sad news is that Pakistan now has a double burden of disease. The rise of chronic diseases, heart disease, diabetes, cancer, are very serious in the country. 1 in 4 Pakistani men is hypertensive. Most don't know it.
Tell me about it, sweetie. Tell me about it. I know. I thought all 4 were, like 4 out of 4 are hypertensive in this country, but yes, anyway. Huh.
Yes, there's interesting science going on in this area. It appears that South Asians are at additional risk of developing heart disease within the context of the subcontinent. It's not clear why. It may be genetic, but it's probably not genetic because there's such a diversity in Pakistan. You go from the north to the south, you see very different people. It probably has something to do with diet. It may be that malnutrition as children sets an adult up to be more at risk of heart disease. When they get to be adults, they start eating properly, and their bodies can't accommodate it. So we have a major problem with obesity, high cholesterol, high blood pressure, all leading to early death due to heart disease. It's a very serious problem. The good news on this is we have some very fine public health activists in the country. Sonia Nishtar, very dear friend of mine, has been a real pioneer in this area, bringing this, first of all, to consciousness. We have this kind of silent epidemic. We have all these people, millions of people walking around with hypertensive, not knowing they have the disease, not on any kind of medication. So it's a big step forward, first of all, to recognize this in policy.
Yeah, I understand. I see when I go to America, I see that a lot of people there, are obese, and they eat the kind of food they eat and everything. Do they have the same kind of problems as we do?
Well, worse actually. 60% of Americans are obese now. Now in Pakistan, it's about 25%. But for those 25%, they're more hypertensive, more likely to get heart disease than the American. So it's that piece about South Asia. It's kind of a South Asian heart disease paradox. We're not quite sure why. It may be the diet, what they're eating. There's a big problem with trans fatty acids. This number 13 oil that people use, poor people don't have money for good oil. It's trans fatty acids. Oils that have been reused are very dangerous for the health. And particularly poor people are using a lot of these oils because they're cheap.
Really? Do you think there's corruption going on in the Ministry of Health? Really?
Well, I'd like to emphasize the positive, and there are some good things going on in health right now. One of our ministers, Jahangir Tareen, has taken on a very bold initiative, the Basic Health Units. Basic Health Units is the government system that provides health care for poor people. And through a mechanism where NGOs provide the service with government support, with government funding, but managed by NGOs, it seems to be a much more effective way of doing things. Something that the ministries need to take seriously and support. Right now, there's some tension within the government. I've been working with the ministry. We hope to see this come forward, but there's got to be public support for this too. There's got to be recognition that people poor people in the countryside need free health care. It's guaranteed by our constitution here in Pakistan, yet they're not getting it because of poor management.
You know, you're more resourceful and more informed than I thought you would be, darling. You said there's tension in the government. Come on, tell me what kind of tension there is. You think Parvez Bhai is going or is he staying? I mean, what's happening? Tell me some political gossip too now. You just came back from Islamabad today, I believe. Huh?
Yes, I did. Yes,
so have you got some nice gossip for me or no?
I'm a technical man. I try to stay out of politics.
You know, in the absence of, as you said, good hospitals and doctors, you know, there's a lot of there's a trend. Well, there has been for the longest in this part of the world of alternative medical practitioners, like like the Hakims.
Peers.
And all peers and the shrines and all kinds of things. Have you studied any of that? Really, in Pakistan?
It's very interesting. I've been had wonderful evenings in different shrines. There's that wonderful shrine on the canal in Lahore, and have enjoyed seeing people go for spiritual healing. We've done studies on this, and while these things are very active, they actually represent a very small part of healthcare in the country. Most Pakistanis want to see real doctors. They go there for maybe their second need or the third need after other things have failed. They go, but it's really, Pakistanis are good consumers of healthcare. Actually, Pakistanis go to doctors more than Europeans and Americans. So there's no shyness about going to doctors.
Johnny. Viral hemorrhagic fever. It's been all over the news channels.
Yeah, we're going through another epidemic.
What is that? You are an expert on epidemics.
We had one last year. About 300 people were hospitalized, and about 30 people died. This is a perfect example of people, of ignorance on the part of well-to-do people. They think that sitting in their bungalows behind their walls they're safe. The mosquitoes come over the wall. It's a serious problem that affects all of us in the city. The issue is the control of mosquitoes, but where do mosquitoes breed? Well, they breed in the Gandanala, where there is water stagnant because of plastic bags. I mean, it's coming back to plastic bags, and again, hygiene issues. One of the problems was all the rain we had this summer, and we have standing water everywhere, breeding a lot of mosquitoes. So it's particularly bad this year.
I must say something. You know, you have such wonderful vibes, really. Such positive vibes. You know, I'm having such a wonderful feeling having you sitting in my drawing room, really. Amazing, amazing.
Oh, you're very kind.
You know, and you sound so nice. You've got an amazing voice too, Gregory. I'm sure you're a professor also, right?
Yes.
Yes. You have to teach me stuff.
Yes.
Really.
Well, maybe I'll teach you to sing.
Huh?
One of my other great loves is singing. My
I
voice,
know I was going to just come to
I was
that.
trained as a singer.
You were?
Oh, yes.
You must then gungunao something. You know what gungunao is, right? Just sing a little, hum a little something for me.
I'm not on stage.
Not on stage?
No.
I mean, this is my drawing room, honey. This is not a stage. But tell me now, please. So what kind of music are you in?
Well, I like all kinds of music. I love subcontinental music. I love the music of Pakistan and India. My favorite is European classical music and opera. And I've sung some opera. I studied voice.
Oh,
But one of the great moments of my life was singing at Carnegie Hall. When I was in medical school, I was in the Cleveland Orchestra Chorus, and I sang at Carnegie Hall. It was a great event. I've had a very fortunate life. I've done many exciting things, and I have to say that was probably one of the high points, is sing with Cleveland Orchestra in New York.
That sounds wonderful. Amongst the Pakistani singers that you've heard, who's your favorite?
Well, I don't know too many names. My all-time favorite is Nusrat Fateh Ali Khan, who's of course dead now. Yeah. Love that classical tradition of singing. It's great stuff.
You are a collector of art also. You like paintings.
Yes, I do collect some paintings.
Yes, and I saw this beautiful painting that I must share with my viewers in your bedroom. You know, that way my viewers will know that I've been to your bedroom. But I saw this beautiful painting in your bedroom. I forgot to ask you.
That is from where I went to medical school in Cleveland, Ohio. A very well-known local artist, self-taught, African-American, by the name of Michelangelo Lovelace. And it's a street scene.
So you like Cleveland, darling?
I'm glad I went to medical school there. I wouldn't want to live there.
Cleveland is nice, but I prefer Thailand. You know how it is. Come on, Johnny. Between the two, which would be your preference, really?
Thailand or Cleveland?
Yes, darling.
I'll take Thailand also.
Oh, darling, then Thailand is all yours then. Yes, yes. Acha, coming back to music, you know, I've been learning some music, some singing also. So I think we must get together, the two of us, and maybe have a musical evening together.
Well, listen to my favorite, Maria Callas.
Really, we must do that.
Yes.
We must do that. Your mom, I met your mom. She's back in New York now. She
back in the States, yes.
Back in the States.
Yes.
Yes.
And she came to visit last April. She was here for a month. We had fun.
What was your biggest inspiration growing up, Greg? I mean, you know, what made you decide that you wanted to be a doctor, really?
Well, to tell you the truth, I didn't have much choice. My dad was a doctor, and I think I was going to be a doctor in utero. My parents steered me very strongly in that direction.